Good morning. I hope it is a beautiful Monday morning where you are, or whatever day of the week it is that you're watching this video. My name is Dr. Lindsay Olgel, and I am a board-certified family and obesity medicine physician. And I started this podcast to share my knowledge that I've learned through medical school and residency, and now in my primary care practice with you to reach more people than the traditional medical system is created to touch. So I am so excited that you have watched this video, that you are willing to take this journey with me and take the time out of your busy day. Just learn more about your health and things that you can do, whether that's just directly from this knowledge or taking this knowledge and bringing it to your primary care doctor to discuss how this would specifically apply to you. So again, thank you so much. And if you like this video, please subscribe because more videos are coming. Every Monday morning, you're going to have a new video that's going to go over a topic that will be relevant to your health or the health of somebody in your life. So stay tuned for more information. Today, we are talking about what happens at a wellness visit for female patients. And this is the type of visit that you would have with your primary care doctor once a year. First in my checklist for women is to ask about last pap smear. The current recommendation is to start cervical cancer screening at age 21 and to continue through age 65. So the guidelines now are actually, studies are showing that we can probably push this age back. A lot of the future guidelines will probably say to start screening at age 25, because what we see is that immune systems of women at a younger age are so robust that if there is anything abnormal on that pap smear, it's likely to self-resolve even without any treatment. So there's really not a reason to test for it or treat it because it's just going to be more visits for the patient, uncomfortable, and it's just not necessary. So I don't really hound my patients to get their cervical cancer screening, their pap smear, until they're 25. And then when you're 25, you absolutely need to get your pap smear. And the good news is, if you have a normal pap smear, you do not need to repeat it annually. When you're in your 20s, you need a pap smear every 3 years. Again, this is if you have a normal pap smear. And then when you're in your 30s to 65, then you only need one every 5 years if it's normal. And the reason for that is that we have started to test for HPV, the human papillomavirus. And this is the #1 cause of cervical cancer. So if the cells on your pap smear are normal and the HPV is negative, we are really, really reassured that you're going to continue to have a normal pap smear, normal results for at least 5 years. And so you do not need to repeat it until 5 years from that time, which most of my patients are very happy to hear when I update them on these new guidelines. And that brings me to, reminds me to mention the importance of HPV vaccine. Now, this is a vaccine that has been out for a few decades now, and to me, it's so exciting that we can give a vaccine that can actually prevent cancer. So getting the HPV vaccine and usually this is done in preteen or teen years, then getting this vaccine can help prevent cervical cancer as well as several other cancers, including throat and neck cancers. So it's very, very important vaccine to get. There's a lot of controversy about it, and I do not have time to go into that during this visit, but just 2 doses of a vaccine can prevent cancer and could potentially eradicate or significantly reduce the amount of cervical cancer in the world is really exciting. So something to take note of here. Next thing on the list is breast cancer screening, and this is typically done with a mammogram. Most guidelines are now saying that everyone should start at age 40. Now, you may need to start screening earlier if you have a significant family history of breast cancer, so talk to your doctor about your family history, but most women get screened annually starting at age 40 all the way through age 75. Any female 65 or older needs to make sure that they have been screened for osteoporosis. Osteoporosis is weakening of the bones that puts you at higher risk for a fracture if you have a fall or an injury. And it's really important to screen for this because we have very effective treatment options to help maintain and improve bone density to decrease that fracture risk over time. And so again, every woman starting at age 65 should be screened, and Medicare will pay for the screening every 2 years. There's various guidelines on how often you should be screened, but Medicare will pay for that every 2 years. So that is typically what I recommend. For my younger female patients, I always go over birth control with them, because for anybody who has the potential for pregnancy, and that is any female patient who is having menstrual cycles all the way up through menopause. So yes, you can get pregnant even if your periods are starting to space out in your late 40s. You have pregnancy potential. It is important to be on a form of birth control if you want to prevent pregnancy or are at risk for pregnancy. There are many different types of birth control, and I'm actually going to do a video that goes over all of these options in greater detail. So stay tuned for that. Any female patient who is sexually active should also be screened for gonorrhea and chlamydia. This can be obtained with a urine sample or a vaginal swab that can either be obtained by your provider, or sometimes your provider will go over that and allow you to collect it yourself. But it's really important for women to have this testing done, because STIs, sexually transmitted infections, can be asymptomatic in women, and they're very, very common, especially in teenage and early 20s. So between 15 and 26, this is really common, and women should be screened annually for these infections. And really, anybody who has had a new sexual partner and has not been tested since that exposure should be retested. And gonorrhea and chlamydia are some of the more common ones, but we do see, of course, HIV and syphilis. These tests should also be obtained, and they require a blood draw. But it's really important. Syphilis specifically is becoming more and more common. Fortunately, we have a very easy treatment for that: penicillin, or if you're allergic to penicillin, doxycycline. But to treat you, we need to know that if you have it, and so make sure that you talk to your doctor about any potential exposures. I'll see you all next week, next Monday, and we will talk more. I look forward to it.